I think in that after photo, he looks 43. That is way too much filler. I'm Dr. Dara Liotta. I am a board-certified facial plastic surgeon on the Upper East Side of Manhattan. Yeah, so John Travolta is really interesting. Again, sort of on my theme, John Travolta's 67. If you look at the pictures from early on in his career and the most recent, it actually leaves out a lot of John Travolta face evolution through the years. I think that he went through a period where it looked like he had a lot of filler and he had a very stiff, that plasticky look. And to be honest, that after picture, he looks pretty natural. You know, if I saw just that after picture and I hadn't seen the evolution of his face through the years, I would say he looks amazing for a 60.
Right.
And you can see he has the normal emotive creases around the eyes. He doesn't look pulled or done. But I would say along the way, you're right. He has had quite a bit go on. I think over the years, at some point, he had filler. He may have had fat injection to the face. Definitely some Botox. Questionable whether he had a little bit of a face or neck lift. He doesn't have any scars that I can see, and his neck doesn't have any telltale pulls. So if he did have a facelift, it was a good one. But I think he's looking much more natural these days, despite whatever procedures he's had in the past, than he has at different times during his career. John Travolta and Tom Cruise, I kind of put in the same bucket as just crazy facial evolutions through the years. And I think that similarly, you know, Tom Cruise is 58. I don't think he looks bad now, but I do think that he's had periods where he's had too much filler. And again, that too much injectable, the filler, the Botox done in not a tailored way, leads people to have that like puffy, unnatural look. And I think he's had that at times over the years.
Yeah.
I do think that when you look at him in the before and after, particularly that we have, I think he's had some jaw work done. Whether it's angle of the mandible implants at some point, or whether it's chin augmentation or filler around the jawline. I think there's been something that's done around the jaw, which I don't hate, to be honest. I think it looks good. It's when the filler gets into other areas where it's like it gets that doughy look. But I think he looks better now than he did. So Zac Efron is 33. I think in that after photo, he looks 43. That is way too much filler. You know, again, I think that filler around the mouth is so quickly, it turns into looking unnatural. Filler, it's made of hyaluronic acid, and when you inject it, it absorbs water and it becomes quite stiff if there's too much in the area. I'm not a fan of injecting a lot around the mouth or lower face at all. And I think that in his case, I think he has filler in his lip. I think he has filler around here. And I think over the course of his career, he's had either a lot of filler at the jaw and chin or implants along the jaw and the chin. But I do not think that he is looking his best currently. I think he looks older. And I think that it is that idea that his face isn't moving like we expect a young man's face to move. So he's 53, James Bond, right? Who doesn't want to be James Bond? But if you look at the before and after, in the after, he has a little bit of a weird doughy look to him.
Right.
In that lower face, it's like a little stiff. And that comes either from filler around the mouth, like we kind of talked about. Filler is a gel and it's smushy, but also his eyes look weird. I don't know if you can look at the before and after and you see the brow shapes changed. It went from being more horizontal to having a peak to it. And the eyelid too, he has more eyelid show. So I think it's some badly done Botox there. Yeah, I don't know. He's a question mark.
Okay.
I mean, obviously has undergone development changes, like body and face. But I do think that he had an alar base reduction, which is not a full rhinoplasty, but I do think he had maybe a little cut here around the nostril to bring the nostril in.
Oh.
Yeah, a tiny little tweak, but makes a difference. And he obviously had a ton of dental work. And I think it's interesting, but the dental work, I think, has changed his lower face a lot. And I think that's a lot of what we're seeing, honestly. I think it's increased like better grooming, skincare, and dental work that's really made a humongous difference.